My name is Amer Zeidan. I am a professor of medicine at Yale University and the chief of the Hematologic Malignancy Division at Yale Cancer Center. It's my true pleasure to be here with you today, talking about high-risk MDS and the potential role for Bexmarilimab in the treatment of those patients. So high-risk MDS is a rare kind of myeloid malignancy. It's a blood cancer that in many patients lead to bone marrow failure with complications of neutropenia, thrombocytopenia, as well as anemia. And we generally divide it into lower risk or high risk. So high risk patients generally have a more aggressive disease. They tend to have a survival that's less than a year and a half without therapy. And those patients generally are treated with hypomethylating agents, or the only way to cure them is with a bone marrow transplant. But most patients are unable to go to transplant because the median age is in the 70s and they have multiple comorbidities in general. So most of the patients are treated with hypomethylating agents. We have 3 drugs approved in the US: azacitidine, decitabine, or an oral version of decitabine called decitabine sidazoride. Now, the outcomes with these hypomethylating agents have improved for patients. However, the median survival is still around 2 years, and less than half of the patients will respond, less than 20% will achieve complete remission. And clearly, we need to improve upon these outcomes. So there has been a number of attempts to add another drug to the azacitidine or the other hypomethylating agents to try to improve outcome of patients. We unfortunately have a repeated number of failures with drugs going to phase 3 trials and then fail. The latest one was venetoclax in the Verona trial. But today I'm here to talk about, I think, an exciting drug called Bexmarilimab. So what is Bexmarilimab? This is an antibody that works against an immune checkpoint protein called cleaver-1. So cleaver-1 is an inhibitory glycoprotein that's expressed on the surface of the macrophages as well as on the blast cells for patients with MDS and AML. It has been shown to actually to be immunosuppressive, meaning that it reduces the function of the macrophages and allows the cancer cells to escape from immune surveillance and proliferate. It has been associated with worse outcomes in patients who have high expression of cleaver-1. And therefore, having an antibody that blocks this receptor leads to activation of the macrophages and basically increases the engagement of both the innate and the adaptive immune system to fight blood cancers, including high-risk MDS and AML. So based on preclinical work with this antibody, it subsequently was taken to the clinic in a phase 1/2 study that has been reported over the last couple of years. Different parts of the study has been reported. Initially, what was reported is what we call the dose escalation part, where different doses of the drug was tested: 1 milligram, 3 milligram, or 6 milligram per kilogram in combination with azacitidine. And initially, the results focused on the refractory relapsed MDS patient population. So those are patients after HMA failure. And what was seen there was encouraging responses along with transfusion independence, as well as, I think, a survival improvement of around 13 months, which in the context of post-HMA failure is encouraging because the median survival is around 6 months. This was in around 20 patients. This was published in Lancet Hematology, and subsequently, these data were updated in the frontline setting. So we included patients. I believe the total of patients enrolled and reported on to date is around 53 patients. So in addition to the refractory relapse patients, that were 20 patients, another cohort of patients were enrolled in the frontline setting in combination with the azacitidine. And the combination there, again, we saw encouraging complete responses as well as evidence of clinical activity. But importantly, the safety was very good. The combination was well tolerated. And now, based on all of these encouraging results, the combination is going to a pivotal trial. It was announced in a press release that discussion took place with the FDA, where the data was reviewed, and there is a pathway now for a registrational phase 2, phase 3 trial that will be randomized of AZA with Bexmarilimab compared to azacitidine alone. So hopefully this trial will confirm the positive results we saw in the early phase trials, and this becomes an option to help our patients with high-risk MDS.